Prostate cancer. Causes of prostate cancer. Signs of prostate cancer. Natural history of prostate cancer. Detection of prostate cancer. Staging and prognostic factors. Treatment of prostate cancer. Screening and prevention. Psychosocial impact. Complications. Causes of prostate cancer. Incidence. Causes. Cancer of the prostate is the most commonly occurring tumor in men. Prostate cancer primarily occurs among older men. Prostate cancer is uncommon before the age of 45. The incidence increases markedly after the age of 60. It is estimated that 1 in 8 men will be diagnosed with early prostate cancer in his lifetime. However, only 1 in 32 men will die from prostate cancer. The incidence of prostate cancer has increased dramatically in recent years. Most of the recent rise is due to an increased rate in early detection rather than a true increase in the rate of prostate cancer. However, a small proportion of the increase may represent a true increase in the incidence of the disease. The death rate from prostate cancer has increased about 1% a year since the early 1970s. Age. Prostate cancer is rare under the age of 45. There is a much greater chance of developing prostate cancer with increasing age. About 50% of the cases of prostate cancer are diagnosed in their late 60s. Racial ethnic factor. African American men have the highest incidence of prostate cancer, with occurrences 30% higher than in the white population. By contrast, the incidence of prostate cancer is lower in the Japanese and Chinese populations. It is thought that incidence of prostate cancer is higher in the African American men because of the higher level of testosterone. Family history. Men who have a family history of prostate cancer in their brother or father are at a higher risk of developing prostate cancer than men without such a family history. An increased risk of prostate cancer in men with a family history of prostate cancer may be due to an inherited susceptibilities to prostate cancer, to shared environmental factors among family members, or to a combination of inherited factors and shared environment. A very small proportion of prostate cancer that occur at early age in multiple family members may be due to a rare inherited gene defect that has not yet been identified. Vasectomy. Vasectomy has been raised as a possible risk for developing prostate cancer, but studies have not shown conclusive evidence to support it. Studies that do suggest increased risk show that the risk increased with time following vasectomy, with the greatest risk seen among men who had a vasectomy 20 or more years previously. The reason for the increased risk is not known. Diet. Diets that are high in fat content, in particular fat from animal sources, have been linked to an increased risk of developing prostate cancer. This link between a diet that is high in fat and prostate cancer provides yet another reason to lower the amount of fat in the diet. Current recommendations are to lower fat intake to 30% of calories from fat. The association between specific vitamins and the development of prostate cancer continues to be studied. Studies so far have not shown a consistent protective effect with specific vitamins. Vitamin A may help to reduce the risk of prostate cancer, but not all studies have shown a protective effect with this vitamin. In fact, some studies have shown an increased risk of prostate cancer occurring at older ages, after the age of 70, with higher levels of vitamin A intake. The possible benefits of vitamin D against prostate cancer are also being studied, but results are mixed. Not all studies show that vitamin D can protect against cancer. Of most interest is the possible protective effect of vitamin E against cancer. Vitamin E can prevent damage to cells from environmental chemicals and other substances that the body produces as part of its normal metabolism. Hormones. Hormones, particularly the male hormones called androgens, such as testosterone, may be related to the risk of developing prostate cancer. Androgens are required for the growth and activity of the prostate gland. Testosterone is changed in the body to dihydrotestosterone. It is thought that it is dihydrotestosterone which may increase the risk of prostate cancer. Benign prostatic hyperplasia, BPH. Most studies show that benign prostatic hyperplasia itself does not increase a man's risk for developing prostate cancer. However, since this condition is more common as men age, as is prostate cancer, sometimes men may have both benign prostate enlargement and prostate cancer. Smoking. Smoking has been linked to an increased risk of developing prostate cancer in some studies. Smoking may also raise the body's sensitivity to the cancer-causing effects of other chemicals, such as cadmium, which have been associated with prostate cancer. Cadmium. Metals that may cause cancer are present in the environment because they are both naturally occurring and because they are used in many industries. Cadmium is one such potential cancer-causing metal. Cadmium is antagonistic with zinc in the prostate gland. Zinc is required by many enzymes for DNA and RNA synthesis, and zinc is concentrated in the prostate. Cadmium is used in industry in many ways. Cadmium is used for metal coating by electroplating, such as cadmium-plated automobile parts, as pigments in paints, enamels in plastics, as a stabilizer in plastics, and as an electrode component in nickel-cadmium batteries. Cadmium also enters the food chain through contamination of soil, air, and water from industrial uses and can concentrate within organisms. Meat products, particularly organ meats, shellfish, and seafood, are significant sources of cadmium exposure. Therefore, individuals may be exposed to cadmium as part of their occupation or from other sources such as food. Tobacco smoke is an additional source of exposure due to the absorption of cadmium by tobacco plants. Higher concentrations of cadmium in the blood of smokers compared to non-smokers have been found. Animal studies suggest that cadmium may cause prostate tumors to occur, but studies in humans have not been convincing. Signs of prostate cancer. It is somewhat unusual for prostate cancer to have any signs or symptoms until it is fairly advanced. The first sign to appear is a lump within the prostate that can be felt on a digital rectal examination. This lump will grow unnoticed by the patient until it becomes a large mass in the prostate gland. As the cancer enlarges, patients may have voiding symptoms such as an urgency to urinate, a slow urinary stream, and occasionally some bleeding during urination. Rarely, the cancer may extend into the rectum, causing pain, and difficulty with bowel movements. The cancer may then spread to lymph nodes and then to bone. The most common symptom is pain in the bones. Usually this is back or hip pain, but it can also be pain in the ribs, pubic bone, and shoulders. Occasionally an involved bone may break. When the cancer has spread extensively, patients will have generalized weakness, lack of appetite, and weight loss. Natural history of prostate cancer. The natural history of prostate cancer is very long. The tumor is small most of its life before it reaches a size large enough to feel. During a man's 20s, 30s, 40s, or 50s, he develops a premalignant lesion called prostatic intraepithelial neoplasia, PIN, which is often multicentric. Eventually, PIN evolves into a prostatic cancer that continues to grow very slowly. The tumor finally grows into a solid mass in the prostate. The cancer is still curable at this stage. Once it grows through the side wall of the prostate, however, it often becomes non-curable. The cancer can grow enough to obstruct the ureters, which drain the kidneys or even obstruct the rectum. By the time the cancer spreads or metastasizes to lymph nodes in the pelvis, it is not curable. The lymph nodes initially involved are the obturator lymph nodes. Later, the cancer spreads to other lymph nodes in the abdomen, chest, and neck. Finally, the cancer spreads to the bones. There, the cancer grows and obliterates the bone marrow. If untreated, the cancer will cause the patient to develop anemia as it replaces his bone marrow. Within the bones, the cancer causes pain. Only in the very late stages does the cancer spread to other organs such as lungs, skin, or liver. Detection of prostate cancer. Prostate cancer may take many years before it actually becomes apparent. As the cancer grows and invades the prostate gland, there are usually no symptoms at first. Detection of the prostate cancer can only be by investigation of the apparently normal male. If the cancer grows large enough to cause symptoms, the cancer has become too far advanced for complete cure. Current methods for detection of prostate cancer are digital rectal examination, DRE, PSA, transrectal ultrasound, needle biopsy, transurethral resection of prostate, TUR. Digital rectal examination, DRE. The standard examination for detection of prostate cancer is the digital rectal examination, DRE. The physician inserts a lubricated gloved finger inside the anus and feels or palpates the prostate gland, which lies on the front wall of the rectum. A cancer can feel hard when compared to the normal prostate gland tissue. Not all cancers can be detected by the digital rectal examination. Some cancers are not distinctly hard. Furthermore, some cancers are not on the back side of the prostate gland. Not all cancers can be detected by the digital rectal examination. Some cancers are not distinctly hard. Furthermore, some cancers are not on the back side of the prostate gland, which can be felt by the examining finger. For screening purposes, all men over 50 should have an annual digital rectal examination to try to detect prostate cancer as well as rectal cancer. Prostatic specific antigen, PSA. PSA is a protein substance made by the human prostate gland and meant to be ejaculated with the semen. Normal human semen clots after ejaculation and then dissolves over about 15 minutes. PSA is responsible for dissolving the clot of semen. Large amounts of PSA are made by the normal human prostate gland. A small amount of PSA normally leaks back into the bloodstream. As the prostate gland grows with aging, slightly more PSA normally appears in the bloodstream. In cancer of the prostate, large amounts of PSA leak back into the bloodstream, where they can be detected by the blood test for PSA. The normal values for PSA are usually less than 4.0. A value lower than 4.0 does not mean a man does not have prostate cancer, but it makes it less likely. A high PSA does not necessarily mean a man has prostate cancer, but it makes it more likely. If an elevated PSA is found in a healthy male, he should be investigated for the possibility of having prostate cancer. PSA levels do tend to slowly rise with age. A man's PSA should be less than 2.5 in his 40s, 3.5 in his 50s, 4.5 in his 60s, and 6.5 in his 70s. The PSA value in men does fluctuate. Little can be made from small changes in a specific man's PSA value. In men with a known prostate cancer, the PSA may be followed as an indirect measurement of growth of the cancer. Men who have undergone total removal of the prostate should have a PSA of 0. Transrectal ultrasound, TRUS. Transrectal ultrasound is usually done if a screening test such as PSA or digital rectal examination has detected an abnormality. Ultrasound is done without anesthesia or sedation. The patient can be examined either on his side or on his back with his legs in stirrups. The ultrasound probe is approximately 2 centimeters in diameter and is inserted into the rectum. The ultrasound waves will then penetrate the prostate. Images are recorded as the sound waves bounce back, much the way sonar waves detect underwater objects. A TV screen shows the images, and they can be recorded permanently. The ultrasound examination takes about 15 minutes, and the only pain involved is the discomfort of having the probe inserted. Possible cancers appear as areas within the prostate that have fewer sound waves bouncing back. These areas are called hypoechoic. Transrectal ultrasound appears to be twice as effective in detecting prostate cancer as digital rectal examination. Needle biopsy. If a cancer is suspected by either digital rectal examination, transrectal ultrasound, or elevated PSA, a biopsy is taken. Biopsies are accomplished by firing a double needle into the prostate gland. A very small piece of the prostate is captured between the two needles. The gun that fires the needles is quick. Therefore, pain is not severe with the procedure. Usually the needles are placed through the rectum, and this also decreases the discomfort. Approximately 6 needle biopsies are usually done on each prostate. The side effects of a needle biopsy are possible bleeding and infection. In order to prevent significant bleeding, patients should not take aspirin, Motrin, ibuprofen, or Coumadin prior to a biopsy. After the biopsy, it is common to have a small amount of bleeding through the rectum or through the penis for several days. The first few ejaculations may contain some blood as well. Infection of the prostate is possible following a needle biopsy. In order to prevent this, most physicians give the patient antibiotics during and after the biopsy. Transurethral resection of the prostate, TURP. Many men undergo removal of the prostate gland because it has grown significantly and is obstructing the outflow of urine. The most common surgical procedure used to remove this obstructing tissue is called a transurethral resection of the prostate, TURP. Only part of the prostate gland is removed. The patient is placed under general or spinal anesthesia. A lighted instrument is used to visualize the inside of the prostate gland. From the inside, part of the prostate gland is scraped out using electrocautery. When the pathologist examines the removed tissue, an unsuspected cancer of the prostate may be found. Other treatments for benign enlargement of the prostate do not give the pathologist any tissue to examine and will not detect a cancer if it is present. When a cancer is detected by TURP, the patient should be fully evaluated and staged. It has been suggested that having a TURP might hasten the spread of the cancer by pushing the cancer cells into the bloodstream. So far, there is very little evidence that this is true, but it does remain a possibility. Staging and prognostic factors. The survival of